Okay, so there's definitely a lot of buzz around these oral glutathione supplements, GSH.
Absolutely. You hear all sorts of claims.
Everything from like amazing beauty results, clearer skin, that kind of thing, to even preventing really serious conditions. Parkinson's disease even comes up.
It does. It sounds almost, well,
Too
miraculous.
good to be true, maybe. So today, we really want to dive deep into why, scientifically speaking, it often is. We're focusing on how our bodies actually, handle something like oral glutathione.
And why it's become one of those popular health myths that, frankly, needs a closer look, a bit of critical thinking.
Exactly. Okay, let's unpack this.
And we're using a fantastic source for this, an article by Professor Lin. It's called Glutathione, Too Far, from his science-based health blog.
A great resource.
Definitely. So our mission here is to use his research to really get to grips with the science behind these claims and hopefully empower you, the listener, to approach health decisions with, well, more critical awareness.
Mhm. And what actually kicked off this particular article update from it gets really interesting.
It does. A reader actually reached out. They'd seen, quote, visible beauty effects in friends taking oral GSH.
Ah, the anecdotal evidence.
Precisely. And then they asked, well, could it prevent Parkinson's? This was despite Professor Lin having already written about his cautions regarding oral GSH.
Wow, that just shows you how convincing personal stories can be, doesn't it?
It really does. But what's great is how Professor Lin brings us back to the fundamental biomedical facts.
Okay, so what are those basics?
Well, glutathione, or GSH, it's something our bodies make naturally. It's a peptide, which is basically a small protein.
Right.
And here's the crucial bit he emphasizes. When you swallow proteins, or peptides like oral GSH, your stomach acid and enzymes just break them down.
Like digesting food.
Exactly. So he states quite clearly, most research papers, the vast majority, do not believe oral glutathione can actually be absorbed into the body in any meaningful way.
So popping a pill isn't like getting an injection.
Not at all. He points out that if someone had a genuine, significant GSH deficiency, the treatment would have to be an injection, not an oral supplement.
It's like trying to mail a detailed blueprint through a shredder and expecting it to arrive intact on the other side.
That's a good analogy. It just gets dismantled. Understanding that basic digestive process for peptides is key.
But, science is always moving forward. Professor Lin wrote his first cautions about 5 years ago. Did he find anything new when he looked at the latest research on absorption?
Yeah, he did look into that. He cites a couple of recent papers, one from 2022 and another from 2025.
Okay, and what did they say?
The 2022 clinical review pretty much confirms it. Glutathione has a, quote, low absorption rate in the gastrointestinal tract.
Still low?
Still low, and it specifically adds that the universal consensus is against using oral glutathione for things like hyperpigmentation, those skin lightening claims.
Interesting. And the 2025 paper?
That one puts a number on it. It states that GSH's oral bioavailability, so how much actually gets into your bloodstream to do anything, is less than 1%.
Wow, less than 1%?
Less than 1%. Because of that breakdown and just poor absorption. And importantly, it points out the need for chemical modification strategies to even try and improve that number.
Okay, chemical modification.
Yeah.
That sounds complicated. How tricky is that?
Professor Lin uses a really helpful analogy here, actually, from another piece he wrote about semaglutide, the drug in Ozempic or Rybelsus.
Ah, right, the weight loss drug. There's an oral version of that too, isn't there?
There is. And he explains that even after tremendous, extremely difficult scientific effort to chemically modify it for oral use, the dose you have to take orally is 50 to 100 times bigger than the injection dose.
50 to 100 times?
Yes. And even then, you only absorb about 1% to 2% into your bloodstream.
Incredible. All that work for such a tiny result.
It really puts it in perspective. And this brings up a really important question one Professor Lin poses directly. The oral GSH supplements you buy over the counter, they are unmodified.
So they haven't had that complex, expensive chemical tweaking done.
Correct. So the critical question for you, the listener, is, if they haven't undergone that modification, should we realistically expect them to have any real measurable effect?
It seems unlikely, based on that evidence.
Very unlikely. If someone does feel better taking them, Professor Lin suggests it's most likely down to the placebo effect.
The power of belief.
Which can be very real, but it's not the supplement itself working biochemically.
So what does this all boil down to for you listening?
Well, I think it really highlights just how important critical thinking is when you hear health claims.
Definitely. Don't just rely on what someone tells you or an advert or even, seeing a friend's results. Look deeper.
Look for solid scientific evidence. Especially ask how a substance is supposed to be absorbed and used by the body. Does the science back that up?
It's not enough for it to sound good in theory. It needs to actually demonstrably work in the body.
Precisely. And maybe a final thought to leave you with.
Now go on.
We've talked a lot about glutathione, which is a peptide. How do these insights about absorption, bioavailability, the need for modification apply to all the other peptide supplements out there? There seem to be so many hitting the market now.
That's a really good point. It encourages a healthy dose of skepticism, doesn't it?
Yeah.
And prompts you to do your own research before jumping on the next bandwagon.
Exactly. Keep asking those critical questions.